At the Health Trust, we don't take on simple problems. We only tackle the tough, overwhelming problems like obesity, homelessness, social inequities, and chronic disease. But really, when you look at it, there's lots of problems to handle, but really we look at the ones where we feel like we can make a real difference, and that's what we really try to attack. You know, 5 years ago, I think when we looked at obesity, it was just an overwhelming challenge. Young kids in our community, especially in low-income communities, were growing up really not being able to manage their weight. And so we looked at how could we increase gardens? How could we start growing our own food? And we invested in not only home gardens and community gardens and school gardens, but even apartment gardens so that everyone would have better access. Today, our government leaders now understand that our health is a function of where we live, and that's progress. The Health Trust has a long tradition of strengthening oral health in this county. We understand the need, and we understand the solution. One of the challenges with services is that kids just didn't have access to good dentists if you didn't have private insurance. And we've really changed that for low-income children. In this county, we've done a lot of work for seniors over the years, primarily in our Meals on Wheels program. But beyond that, we had to really look over these last 5 years of what can we do to engage seniors in their own advocacy, in their own leadership. It's important to us that we provide comprehensive services to our HIV/AIDS clients and to be able to get the resources to be able to do that. So we've instituted Dining Out for Life and our Hike and Bike and other kinds of fundraising activities which really engage the community in being able to support us in the important work we're doing in HIV. It's unconscionable that we have the largest homeless encampments in the country. The way to end homelessness is to find people homes. And that's what Destination Home, a program of the Health Trust, is doing. One of the trends that we've seen over the last 5 years is a reduction in government funding, as well as an increased need from the community. What we had to do is think differently. We've been thinking about it from a disruptive innovation perspective, an entrepreneurial perspective, really a strategic perspective. And that's what's going to get us to be able to be successful as we move forward. As the Health Trust tries to tackle these tough problems, even with our resources, we can't do this alone. And we've only been able to be successful over these last 5 years with the donor community supporting us. I know that Silicon Valley can be the healthiest place in America for everyone. It just takes us working together in order to accomplish that.